History and scope of fertility care. Historical development of fertility care.
Fertility care, also known as reproductive medicine, has evolved significantly over the last century, with major milestones that shaped its modern-day practice. Ancient and medieval understanding. The understanding of fertility has existed for thousands of years, but early views were largely influenced by religious and cultural beliefs. Ancient civilizations often used various herbs, rituals, and mysticism to address infertility. In ancient Egypt, texts from around 3000 BCE document various remedies for infertility, including the use of plants and incantations. In medieval Europe, treatments for infertility were rudimentary, and reproductive issues were often seen through the lens of morality, with many believed to be a result of divine intervention or punishment. Advancements in the 18th and 19th centuries. During the 18th century, a more scientific understanding of reproduction began to emerge. Anatomical studies on the female and male reproductive systems started to contribute to the understanding of conception. The first successful artificial insemination in animals took place in the early 1800s, followed by the first documented human artificial insemination in 1884 by Dr. William P. Murphy, but it was still a highly experimental approach. By the 19th century, the discovery of sperm and egg as the essential components for human reproduction paved the way for modern fertility treatments. Early 20th century and birth control development. The early 1900s saw more concrete research into human fertility, with the discovery of hormones such as estrogen and progesterone, crucial in regulating reproduction. In the 1920s, researchers like Dr. John Rock and Dr. Gregory Pincus laid the groundwork for hormonal contraception, which, while not directly linked to fertility treatments, changed the landscape of reproductive care by giving women more control over their fertility. In the 1940s, significant steps were taken toward understanding the role of the fallopian tubes, the uterus, and sperm motility in human conception. 1970s, IVF and assisted reproductive technologies. The 1970s marked the beginning of modern fertility care, with the development of assisted reproductive technologies, ART. A breakthrough occurred in 1978 when Louise Brown, the world's first test tube baby, was born in the UK after an in vitro fertilization, IVF procedure. This was the culmination of decades of research into IVF, where eggs were fertilized outside the body before being implanted into the mother's womb. Dr. Robert Edwards and Dr. Patrick Steptoe were pioneers in the development of IVF. For their efforts, they were awarded the Nobel Prize in Physiology or Medicine in 2010, nearly 3 decades after their pioneering work. 1980s to 1990s, advancements in ART. The 1980s and 1990s saw the refinement of IVF and the development of additional ART methods like intracytoplasmic sperm injection, ICSI, a procedure in which a single sperm is injected directly into an egg. This revolutionized the treatment of male infertility. Freezing techniques for eggs, sperm, and embryos became more effective, providing more flexibility in fertility treatments and allowing women to preserve their fertility for future use. In 1992, the first successful embryo freezing and subsequent pregnancy was achieved, opening the door for fertility preservation. 2000s and beyond, modern art and genetic testing. In the early 2000s, ART continued to advance with the introduction of genetic testing of embryos, pre-implantation genetic testing, or PGT. This allows for the screening of embryos for genetic disorders before implantation. Advancements in cryopreservation, which ensures higher success rates in fertility preservation and IVF cycles, have been crucial for the growing number of women opting for egg freezing as a method of fertility preservation. Surrogacy and egg-sperm donation became more commonly practiced as legal frameworks around these technologies developed in many countries, making them accessible to a wider range of patients, including same-sex couples and individuals with fertility challenges. Recent innovations have included stem cell research, gene editing techniques like CRISPR, and advancements in artificial intelligence to enhance treatment protocols and predict outcomes more accurately. Scope of fertility care today. Fertility care today is a dynamic and expansive field focusing not only on helping individuals and couples who are struggling with infertility, but also on providing fertility preservation, family planning, and genetic counseling. Key aspects of modern fertility care. Fertility preservation. Fertility preservation refers to techniques like egg freezing, sperm banking, and embryo freezing, enabling individuals, often women, to preserve their fertility when facing conditions like cancer, advancing age, or medical treatments that could affect fertility. Increasingly, women are choosing to freeze their eggs as part of their reproductive planning. It is an option for those who wish to delay childbearing for personal or career reasons. Assisted reproductive technology, ART. ART is one of the main components of fertility care today and includes procedures such as IVF, ICSI, egg/sperm donation, and embryo cryopreservation. IVF remains the cornerstone of fertility treatment, with millions of babies born through this method worldwide. RT also includes third-party reproduction, such as gestational surrogacy, egg donation, and sperm donation, providing solutions for individuals with specific fertility challenges. Genetic counseling and testing. Advances in genetic screening have become an essential part of fertility care. Technologies like PGT, pre-implantation genetic testing, and genetic counseling help patients avoid passing on genetic disorders. These technologies enable healthcare providers to offer personalized fertility treatment plans that take genetic factors into account, increasing the chances of a healthy pregnancy. Male infertility treatment. Male infertility has become a significant area of focus in fertility care. Advancements in sperm retrieval techniques, such as testicular sperm extraction, TESE, and in ART techniques like ICSI, have allowed many men with low sperm counts or poor sperm quality to father biological children. Hormonal treatments and surgical options for varicocele repair, a common cause of male infertility, have also expanded the treatment options available to men. Women's health and hormonal treatments. Fertility treatments often include hormonal interventions to regulate the menstrual cycle and stimulate ovulation. Medications like Clomid, clomiphene citrate, and gonadotropins are commonly used to improve egg quality and increase the chances of conception. Women with conditions like polycystic ovary syndrome, PCOS, endometriosis, and blocked fallopian tubes may benefit from these hormonal treatments and fertility-enhancing procedures like laparoscopic surgery. Fertility and age. As more individuals delay childbearing, age-related infertility, especially in women, has become an important focus of fertility care. Advances in reproductive medicine allow older women to conceive through IVF and egg donation, with many clinics offering specialized treatment for those over 40. Counseling about the impact of age on fertility and treatment options for older women is a key part of modern fertility care. LGBTQ+ fertility care. Fertility care is increasingly inclusive, with growing numbers of LGBTQ+ couples seeking reproductive options. RT and fertility preservation techniques are available to same-sex couples and individuals desiring to become parents. Legal considerations are important, especially regarding egg and sperm donation, surrogacy, and parental rights, which are being addressed by fertility clinics globally. Holistic and complementary fertility treatments. Many fertility clinics also integrate complementary medicine with traditional fertility treatments. Practices such as acupuncture, yoga, and nutrition counseling are often offered as supportive therapies to enhance overall reproductive health. Some patients choose these therapies to help reduce stress and improve the success rates of ART procedures. Future of fertility care. As the field of fertility care continues to evolve, several emerging technologies and trends are shaping the future. Gene editing and CRISPR. The potential to edit genes to prevent inherited genetic disorders or enhance reproductive health could revolutionize fertility treatments. Artificial wombs. Research into artificial wombs and growing embryos outside the human body could one day provide a new approach to pregnancy and childbirth. Improved IVF success rates. Continued advancements in IVF and ART technologies, combined with personalized medicine, may lead to even higher success rates and more accessible fertility treatments. Fertility insurance and coverage. As fertility treatments become more commonplace, there may be an increasing push for insurance providers to cover the costs of RT, making these services more accessible to a broader population. The scope of fertility care is diverse and expanding, continually integrating cutting-edge science and technology to meet the needs of individuals and families around the world. It encompasses medical, emotional, and ethical aspects of reproductive health, providing hope and solutions for many facing fertility challenges.